Testing should really clarify a clinical story and not replace one. When someone comes in with a long list of labs they've seen online, I first want to understand their story. What are they feeling in their body? How long symptoms have been present? How are they sleeping, eating, managing stress, and what they're hoping to change? So labs are most helpful when they're used to clarify a clinical question, not when they're used as a starting point out of overwhelm or uncertainty.
Welcome back to Medicine with Meaning with Dr. Julie Ta. Today's episode is about something many people feel confused and sometimes anxious about: medical testing. Blood work, hormone panels, gut tests, genetic tests. It can feel overwhelming, expensive, and unclear. This conversation, it's about bringing clarity and understanding when testing is helpful, when it isn't, and how to use labs as tools and not as labels. Dr. Julie, let's talk about how to think about testing in a more grounded, meaningful way. So, Dr. Julie, many patients come in with long lists of labs they've seen online. How do you think about testing from a whole person perspective?
Well, from a whole person perspective, testing should really clarify a clinical story and not replace one. When someone comes in with a long list of labs they've seen online, I first want to understand their story. What are they feeling in their body? How long symptoms have been present? What's happening in their life? How are they sleeping, eating, managing stress, and what they're hoping to change? So labs are most helpful when they're used to clarify a clinical question, not when they're used as a starting point, out of overwhelm or uncertainty. And in holistic and functional medicine, we think about testing as just one layer of information. This is alongside your symptoms, daily habits, nervous system and emotional health, environment, and your medical history and timeline. So it's all part of understanding the full picture of what's going on in the body. And oftentimes, the most important first step isn't advanced testing. It's really about stabilizing the foundations of health, like sleep, nourishment, blood sugar balance, and then stress regulation. And once the body is more regulated, lab results are often more meaningful and actionable. And so what I tell my patients is more testing doesn't always create more clarity. It really is the right testing at the right time. So from a whole person perspective, the goal isn't to test everything. It's to test what actually matters, interpret it carefully, and then connect it back to real life. Again, how you feel in your body, what you're dealing with day to day, and what your body has been trying to tell you.
So what is the difference between using labs to guide care versus using them to chase answers?
I would say using labs to guide care means testing with a clear purpose. There's a question we're trying to answer based on someone's symptoms, their history, and the patterns we're seeing. The lab helps confirm what we're thinking, or maybe it'll point us in a slightly different direction so we know what to do next. Chasing labs, on the other hand, it usually comes from a very human place that, feeling unwell and hoping the next test will finally explain everything. But more testing doesn't always bring more clarity. Sometimes it just gives us more numbers to sort through without really changing the plan. So I often tell my patients labs are most helpful when they help answer a question and not when they become the question. Again, that whole person medicine, it's the patient's story that leads and testing follows that. So it's really important to identify what's most relevant and actionable right now.
Has it happened to you that I've seen it happen with people where they feel uncomfortable or uneasy in a period of time in their lives and they're seeking answers? So they go to the doctor to see if there's some sort of, like you said, some sort of lab that will point to what is going on. But in reality, maybe things are just hard. They're going through a period of emotional change or stress. And and that's when I feel like I've seen that people chase labs because they think that it might be something physical.
Well, I think it's fair and important for everyone to get assessed if their symptoms are worrisome or persistent, and that you need to have a clinician walk you through that. And I think labs certainly have a time and a place. And if it's not clear what's going on, it's important to send testing. But they may not have all the answers. And I think, that's what's frustrating for many people is a lot of times, their labs are normal and it's still not clear what's the cause of their symptoms. And I would say to that, certainly you want to make sure that a comprehensive set of labs was done, right? And that there's a sort of a stepwise process that we want to look at, what would be the root cause of your symptoms. And, I think when people hear that your labs are normal, but they still feel bad, it both can be true at the same time. That is, standard testing may be normal and their symptoms are still very real. So when I see this or hear this, it may be that normal labs don't show disease, right? That basic screening tests don't always show disease, and that it may just be that the body is not functioning optimally. So, there are many layers, and I think it is important to have a clinician kind of walk you through all those different layers. And the other thing I want to add is that, we can't measure dysfunction, right? Oftentimes we're just measuring disease, but our current testing is limited by the tools and technology that we currently have at this moment in time. And not every physiological imbalance or early dysfunction shows up clearly on labs. And besides that, from a functional medicine perspective, there are many different layers beyond some of the basics. Some of these deeper areas could be gut health, mitochondrial function, or immune activation causing inflammation. And so sometimes, the first round of labs looks normal, and you may need to dig deeper with more advanced testing to uncover the full story.
And I know you've mentioned before, we can't measure everything still. As much as there's so much technology nowadays, the body is still much more complex than we've been able to figure out up until now. And that's why you say the whole person story, right? Maybe there are things that you can see in symptoms and not always in labs.
Yeah, for sure. I mean, really going back to the basics, the foundation of lifestyle and your habits. If you're sleep deprived or you have sleep apnea, for instance, that obviously can impact your energy the next day, but we're not going to be able to measure that in a blood test. you would have to do other tests. And for sleep apnea, you would have to do a sleep study. And then, just looking at our sleep, someone may be prioritizing sleep, but perhaps they're not getting restful sleep. So, it's nuanced. And I think fatigue is a really good example of, there's just so many layers that you need to look at beyond just basic blood work. And basic blood work is important when we look at fatigue. But, that's not always the full picture, especially if, nothing comes up in the blood work.
And Dr. Julie, when you say you don't test everything at once, why is a stepwise approach often more effective and less overwhelming?
For sure. This is really important to keep in mind that a stepwise approach makes testing more meaningful and certainly less overwhelming for both the patient and the clinician. When we test everything at once, we often end up with a long list of findings that aren't clearly connected to the symptoms, and that can create confusion, anxiety, and the temptation to address too many things at the same time. And that is where the overwhelm will set in. And, doing everything at once rarely leads to clarity or lasting improvement. So when testing happens in stages, we can start with the most likely contributors. Again, supporting, those foundations of health. And if things aren't better, reassess. Often what we learn is how the body responds to certain interventions. And our body will tell us whether we need additional testing. And sometimes you don't, right? So this stepwise approach keeps the treatment and the care focused. It's easier to interpret. It's collaborative rather than reactive, and certainly less overwhelming. So I often tell my patients, good testing is like good medicine. It follows the story, responds to what we learn, and it unfolds in stages. And it does require a patience, right? That I think our human nature is to want all the answers all at once. And sometimes it requires time to figure out what's going on in our body. And a stepwise approach is, I think, a wise approach.
And I guess health is an ongoing project, right?
It's a life project.
And Dr. Julie, was there a time early in your career when you relied heavily on lab results and later learned the importance of pairing them with the patient's story?
Yeah, for sure. So early in my career, I definitely relied more heavily on test results. And that's very natural. Part of being a newer clinician. When you have less clinical experience, testing can feel like the most reliable source of certainty. It's something we definitely lean into. But over time, through repetition, pattern recognition, and seeing many, many patients, you begin to develop trust in your clinical judgment. You start to see how often the patient's story and their symptoms and their timeline point you in the right direction. And this is even before testing is done. So labs, of course, are still incredibly valuable. But now I see them as supporting the clinical picture, not defining it. And over time, you realize that test results don't exist in isolation. They exist within a person's life. That is their nervous system, their daily habits, their stress load, And so that overall context all matters. And when you pair labs with careful listening and clinical experience, the numbers start to make a lot more sense. So it's really a shift from asking, what do the labs say, to asking, what is this person's body telling us? And how can labs help us understand that better?
That's really interesting. Yeah, I bet that after years of experience, you see someone and maybe, well, I don't know if I'm exaggerating, but I can imagine that you see someone's even like skin color in terms of if they're looking a little bit more pale or how they're walking in, you can already tell, oh, this person has a fever. I don't know.
Well, you really hone in on your observation skills. And, that's one of the first things we learn in medical school. Part of the physical exam is observation. What does this person, how do they appear? So that's number one, just observing. And then, what comes later on, which is so cool, and I, feel grateful for my years of experience, is that clinical intuition. And it's more of a feeling. Obviously you still have to use your clinical skills to gather the story, do the physical exam, assess it cognitively, but then there's a part of you that, also is, it's that intuition, and that's, harder to learn in the beginning. And it really takes time, repetition, experience. And, when you hone in on it, it does feel really good, in terms of, gosh, all those years have paid off.
And Dr. Julie, has your own experience as a patient shaped the way you now approach testing and interpretation?
Certainly, my own experience as a patient has helped me to appreciate that testing isn't only about diagnosing problems. It's also about prevention and early awareness, especially when it comes to metabolic health, which is, one of the issues for me, to focus on. And the thing about metabolic conditions is that you don't feel symptoms. They develop quietly. And so someone can feel completely well while they have changes in their blood pressure, blood sugar, cholesterol, inflammatory markers, or they're fasting insulin. And so these are all the biomarkers of metabolic health. And so it's really important to screen in these areas so that we can identify risk early and intervene before symptoms appear or chronic disease ever appear. So that experience reminds me that labs aren't just about explaining how someone feels today, but it's also about how we can help protect their future health. So it's made me more thoughtful about how results are interpreted and communicated. And, numbers alone don't tell the whole story. And again, we have to bring in that context. And, when we put things in context, it really, prevents that unnecessary worry. And keep in mind that testing is sort of a tool for understanding patterns and guiding prevention, and that these numbers can change. And so it becomes very empowering, especially in the realm of metabolic health. All those biomarkers that I talked about earlier, you can change those numbers. So, in my practice, I think about testing in two complementary ways. First is listening to the body when symptoms are present, right? Doing testing to understand better, what our symptoms are telling us. And then the second is looking ahead, doing testing to prevent chronic diseases. And so, I wanted to bring in that aspect as well.
So prevention can be checking the labs to see if the biomarkers are not in the optimal state, but they're not yet disease. So you don't have to treat the body once is in a state of disease, but you're just checking it and putting it back in balance. And we don't often do that, right?
For sure. A beautiful example is insulin resistance, which happens well before someone develops even prediabetes. And we know prediabetes develops into diabetes. And I think, unfortunately, in conventional primary care, we're not checking fasting insulin and trying to diagnose early on this insulin resistance. And we diagnose diabetes, which, it's good to diagnose diabetes and, really take care of it so that you don't prevent some of the sequelae, the consequences of uncontrolled diabetes. But you can go several steps back where if you have a fasting insulin and it's high, your blood sugar can still be normal, but you have a clue that, goodness, in years, this fasting insulin, if nothing is done in terms of lifestyle, this person will likely develop prediabetes. And so you want to certainly diagnose prediabetes. And, when you diagnose prediabetes, you become empowered to prevent diabetes. So there's just so many stages along this path where you can truly prevent a disease and of course, reverse chronic disease like diabetes with lifestyle.
And in that case, Dr. Julie, how would someone, if they're, like you mentioned that metabolic symptoms are quite quiet, or it's hard to know that there's metabolic imbalance for most people. So how would you say that people start preventing when they have no idea there's something they have to prevent?
Yeah, well, first they should go see their doctor. And in conventional primary care, they're going to check your blood pressure, they're going to check your cholesterol, your blood sugar. Maybe you can ask for a fasting insulin. And so having an idea, there's a slogan, know your numbers, in terms of metabolic health, know your blood pressure, know your blood sugar. And so that's empowering, and people should get tested for these they're called screening tests, right? And so if you have a family history or you're overweight and obese, these are things that you should get evaluated for.
And Dr. Julie, in your practice, what are the most commonly misunderstood lab results that cause unnecessary worry for patients?
So, in my practice, the lab results that most often cause unnecessary worry are numbers interpreted without context. So I'm not going to rattle off a bunch of specific lab tests, but I want to really hone in on this point. So labs capture one moment in time, and they're influenced by what was happening in the body that day or the day before. Did you sleep well? Was it a stressful day? Do you have a recent viral illness? What's your hydration status? These are all important to keep in mind when you interpret labs, because, these things can cause small shifts in lab values, and that's normal and temporary, but not necessarily harmful. I'll give a really interesting point. I had a patient who had ran the marathon, that weekend and went and got blood work on Monday, and her inflammatory markers were really high, which is normal. After you run a marathon, there's a lot of inflammation in the body, which is perfectly normal, and your body's going to heal from it. And we know she healed because we rechecked it, I don't know, a month later, and all the inflammatory markers came down to normal. They were low. So, it's an example of this was a normal response, but of course, it was alarming to see such a high inflammatory marker. So, it's really important to have a clinician guide you through the interpretation. And another point I want to make is that, there are some labs that are slightly outside of the reference range. And this may be due to just natural biological variation. And it doesn't automatically mean that there's something wrong. And at the same time, there are labs where, you may fall into that normal range, but still, there's room for optimization. Especially, when we're thinking about, vitamins or nutrients, you want to be in that sort of optimal level. Same with, metabolic health. You want to be in that optimal level. So I think it's really important that, you look at the context of when the labs were drawn, what was going on in your life, and that, you understand the whole person in front of you. What is their family history, their lifestyle, and not just look at, that one number on the lab report. So, what I often tell people is that your labs are dynamic. They're fixed. And they're going to change based on, your lifestyle habits, which is the empowering part, right? That you can improve your numbers. And so, instead of seeing labs as good or bad, I encourage my patients to see them as information about the body in that moment. And it's something we interpret thoughtfully, and we work on it together over time. And so, it's really important that you have someone who can connect the numbers to your own health story and help you decide what actually matters. And so it's important to, work with a trusted clinician who can help you interpret what's important, what's not, what's optimal, what, needs improvement. And of course, how to improve it, right?
And Dr. Julie, for example, if had this patient not ran a marathon with that really high inflammatory numbers, what would someone think it could be?
There's a whole number, a whole list of things. The most common is having a cold. So, probably a good idea to wait until you've recovered from a cold before getting blood work done. That happens all the time. I see that very commonly. So there are a lot of reasons, and I'm talking about an inflammatory marker called HSCRP. It measures inflammation systemically in the body. And there's a whole list of things. Most commonly, people who are overweight or obese, they can have inflammation due to, the extra fat. People who have autoimmune conditions, that are active and flaring, that number is going to be elevated. If you, even, I would say, high stress in your life can raise the HSCRP. I saw that in myself. In fact, it wasn't super high, but it was high. Like my HSCRP should be good, normal, low. What else? Oh, oral health. If you have any inflammation in your mouth due to an infection or gingivitis, periodontitis, I've seen that raise HSCRP. Women on birth control, I see that very commonly. So there's just a whole number of reasons why someone may have elevated inflammatory markers, and you really need a clinician to guide you through that. And sometimes, we need to figure out, oh, well, that person, doesn't have this, that, or the other. Why is it still high? And we have to do further testing to figure out what is the source of this high inflammatory marker.
But Dr. Julie, when you say that labs are dynamic, I guess it makes a lot of sense because we're alive, right? So these things are changing, whether you eat something or I guess that's why you mostly do labs in a fasted state, right?
Yeah.
Because as soon as you eat or whatever, then things start to move around, as it makes sense they would. But can, for example, someone have high cholesterol just for a moment? And
Yeah. Well, this is funny too. So I've been getting blood work for my patients in January. It's February, but last month was January. And over and over again, people's cholesterol were higher than previously, because why? It was the holidays. So, people let loose, enjoyed the holidays, as you should. And a lot of people, their cholesterol went up. And so I tell them, well, I asked them, what'd you do over the holidays? And, people confirmed that, they were eating more sugar. They were, not, living their usual optimal lifestyles, and it showed in their numbers. And I reassured them, don't worry, this is temporary. And, something like cholesterol being high for a short period of time is not going to be harmful. It's not going to cause heart disease, but it's over years and years of high cholesterol, high inflammation that can lead to heart disease. So, I told all of them, it's okay. Let's repeat these numbers in 4 months or so and, get back into your usual routines. And I'm very confident those numbers will come back down.
okay, yeah, I wanted to learn a little bit about that because like you said, the body is a living organism. So it's good to know these things, to not be alarmed if just one thing isn't optimal in one moment, right?
Mm-hmm.
So Dr. Julie, just to be really sure, what are situations where testing really does change the core of care and bring clarity or relief? So I know we don't want to overdo it and be overwhelmed, but in which situations is really important to.
For sure. If you don't test, right, you can't see. And so, when labs identify something treatable that explains symptoms, so, things like iron deficiency contributing to fatigue, or thyroid dysfunction affecting mood and energy, blood sugar dysregulation, nutrient deficiencies, and again, signs of inflammation. In all of these cases, testing helps us move from that uncertainty to creating a clear and actionable plan. And testing can also be powerful when it rules out something more serious, right? Because it often brings reassurance. And sometimes the relief comes from not finding something wrong, but, knowing that, everything is okay, that, you don't have these serious things is reassuring. So, there's so much value in that. And then earlier we talked about, screening for cardiometabolic risk factors or risk patterns, I think is really important for that true, prevention of these chronic diseases. And in functional medicine, we often do advanced testing or targeted testing to uncover underlying, root causes or contributors that weren't initially obvious. And this helps patient understand, better why certain symptoms have persisted. So I often tell my patients when testing is done thoughtfully, it can replace that uncertainty with a direction or like a roadmap, and it gives both the patient and clinician more confidence about, what to do next. So testing can be very valuable.
And Dr. Julie, not to go super off topic, because I know that labs, like you mentioned right now, they're made to give us clarity, but can I do testing out of curiosity? Can I come to you? Not curiosity, but
Yeah.
is there some benefit to that?
So it depends on, what you're curious about. So it depends on what test, right? So I think basic blood work, I think everybody should get that, especially if it's inexpensive or covered by insurance. That's a no-brainer. But then, if you want to do some advanced testing, so let's talk about comprehensive stool testing that's available, from functional medicine clinicians. I would be a little wary about this one and when and why. So if you're feeling good, you don't have any symptoms really, and you don't have digestive symptoms and you don't have any inflammation in your body that you're trying to heal vis-a-vis optimizing gut health. And you're pooping daily and you have optimal stools, that's a sign of good digestive health. You really want to question looking. And the reason is you're feeling great. What intervention are we going to have, right? Like, backing up, you're living an optimal lifestyle, you're taking good care of yourself. Like, all systems go, everything's good. I would question doing a stool test in you. As your doctor, I wouldn't recommend that. If you wanted to do it, I'd be willing, but I would say, okay, here are the caveats. And, we should proceed thoughtfully. So, if we find some things, are we going to, treat it? Because you're feeling good. You're living an optimal lifestyle. And in medicine, no test is perfect. And, there are things like false positives, false negatives, and we're taught in medical school to order a test, keeping in mind the patient and their context. So from a conventional perspective, they'll say, no, don't do that. But I get it, in functional medicine, we want to optimize, we want to do all the different tests that are available out there. And so I would say, look cautiously, be ready to, the other thing that we say is, are the results going to change our management? Like, if we find things, are we going to intervene? Are we going to put you on a gut healing protocol? And sometimes you can do more harm than good when you do things unnecessarily. So to answer your question, it really depends again on the context of the person, if they're feeling well. I'm not sure I would do a stool test, comprehensive stool test. But certainly, if you're having symptoms, looking at gut health is important.
So this ties beautifully into how we started the podcast about it being a whole person story, at the end of the day, you made a really good point. Like, if you feel well, then what is this need of always looking for something, right?
Yeah.
It's like,
I think that is a problem, use your body, mind, and spirit to inform you how you're doing. It's kind of hard to argue against feeling good. I don't mean argue against it, but just like, create cause for looking deeper. Yeah, that's a whole nother episode in and of itself, because there is so much advanced testing out there. And, yeah, it's definitely, well, it's uncharted waters.
and I
And
think, yeah, another episode, and I would like that. But there is a whole narrative about wanting to, people already feeling good, but wanting to feel better or chasing something that they don't even really know what it is. And of course, there's new technology and science, and maybe that's why people are curious about knowing more. Like you mentioned, there's also beauty in just listening to your body, and if you're feeling well, why? I don't know. Maybe we can talk about it in a whole different episode. But Dr. Julie, having said all this, you talk about the body as an ecosystem. So how do labs fit into that ecosystem without becoming the whole story?
well, when I talk about the body as an ecosystem, I mean that health is shaped by many interacting systems: our metabolism, hormones, immune function, the nervous system, the gut, sleep, our lifestyle patterns, the environment around us. They're all influencing one another. So labs help us observe parts of that ecosystem, but they don't capture the whole environment. So you can think of them more like snapshots of a specific process, but you're really not going to get the full landscape. So they can show us, patterns in metabolism, inflammation, nutrient status, or hormone signaling, but they don't measure the lived experience. Things like stress load, resilience, daily rhythms, relationships, or how someone actually feels in their body. Going back to just, connecting with how you're feeling in your body, and, to trust that if you're feeling good, stay with that. But I think, the more common is that people don't feel good in their bodies. So it's really important that labs are, used in this broader ecosystem, that it's integrated into this broader ecosystem. And to not just focus, on the numbers, and, definitely, don't look at data in an isolated way. And so I say, labs show us pieces of that ecosystem. It's really the patient's story that shows us how it's all connected and interconnected.
And Dr. Julie, how do you help patients stay grounded emotionally and mentally when lab results are abnormal or unexpected?
Yeah, so when lab results are abnormal or unexpected, the first thing I try to do is slow the moment down and create perspective. So lab numbers can feel emotionally charged. It's like getting a report card or something, right? And so when something's flagged as high or low, you feel like you're being judged. But I remind patients that, these lab results, it's information about the body in that moment. And it's not a diagnosis, not a prediction, and not a definition of their health. And again, we talk about that context, right? That many abnormalities are modifiable, they're temporary, and it's something we watch over time. rather than react to it immediately. And I also focus on restoring a sense of agency. I think this is so important that when patients understand what the results mean and what steps we can take, whether that's lifestyle changes, repeating testing, or starting treatment, right? In terms of a medication, for instance, that anxiety often shifts into clarity and direction. And I think, people knowing they have agency is so important. So I remind people that health is a process and it's not a single lab report. And that's why I tell my patients, the continuity is so important. I'm here for you. I'm by your side, and, we're going to work on this together, and to recheck in the future, is so important. And that, the body is dynamic. And again, these markers, they change in response to all the, daily lifestyle habits, sleep, nourishment, movement, stress regulation, and our environment around us. So I tell people, this is something we will work on together, not something you fear. And this helps people stay grounded, perhaps curious, and certainly engaged, rather than overwhelmed by the numbers.
And Dr. Julie, for someone listening who feels overwhelmed by testing options or unsure what they should be testing for, what's the best place to start?
Well, I would say don't start with a long list of labs or, advanced testing. Start with a conversation with your doctor. And, start with understanding what symptoms you're having, what are your health goals, and what your personal risk factors might be. And once that's clear, the right testing becomes much easier to identify and far less overwhelming. So for most people, you can begin with foundational screening and basic blood work to get a broad picture of health. And don't forget checking your blood pressure, because that's really important. We talked about some of those cardiometabolic markers like blood sugar, fasting insulin, cholesterol, inflammatory markers, and key nutrient levels. And that, the testing needs to be guided by your personal and family history. And so this establishes a baseline, which is a good starting point. And this is the most important, that testing should be individualized and not driven by trends online or what someone else is doing. And the right testing depends on what your body is telling you and what stage of health you're in. Are you trying to prevent something? Or do you have a symptom that you're investigating? Or you have a chronic condition and you want to improve your chronic condition and you're receiving ongoing care. So this is where working with a clinician can be really helpful, and that person can help you prioritize what matters most and guide testing in that step-by-step approach. And I would just say start with the foundations, let your symptoms and your story guide the next steps.
And Dr. Julie, if there was one thing you want listeners to remember about labs and their health, what would it be?
So I would say labs are tools to support your health. They're not the definition of your health. It gives us information about what's happening in the body, but they always need to be interpreted alongside symptoms, lifestyle, medical history, and that bigger clinical picture. And a number on a lab report isn't a judgment or a prediction. It's just a signal we can learn from, and it can be helpful for guiding treatment, certainly guiding prevention. And, sometimes it just simply reassures us that the body is safe. And, I think it's important to just keep listening to our body more closely. And the goal is not perfection in the lab numbers. The goal is understanding your body well enough to support it wisely over time.
Thank you, Dr. Julie. Well, we've reached the end of our episode.
Well, if today's episode brings up questions for you about labs or testing or your own health journey, you're always welcome to reach out. You can visit me at www.julietawmd.com. That's my website. Or send me a DM on Instagram at julie.taw.md. And I always welcome any questions.
Thank you for joining us for this episode of Medicine with Meaning. Lab results are information, not identity. When paired with your story, your symptoms, and your life context, they can be powerful tools for healing. Share this episode with someone who feels overwhelmed by medical testing, and join us next time as we continue exploring health through a whole person lens.